now with a GMA Health alert tackling migraines. You know they can be debilitating, but there are ways to spot them early, get ahead of the pain, and feel better as quickly as possible. And ABC News Chief Medical Correspondent Dr. Narula is here with a lot more. I know you yourself suffer from migraines.
I do. I grew up watching my mom suffer and thought I might escape it, and then in my 40s started to get them myself.
Right.
And, you know, Juju, they can be really debilitating, and we think of them as really not just a headache, but a neurologic disorder, and it does affect about 12% of Americans, more women than men. 80% of people will have a family member, parent, or sibling who does have migraines, so it does seem to be genetic, and everyone's migraine pattern is different in terms of how often you have it, but they can last anywhere from 4 to 72 hours. And they're really kind of this hallmark of 4 stages that you progress through. So there's the prodrome, which is the early stage. So 1 or 2 days before you get the headache, you may feel sort of tired, moody, neck stiffness, constipation, fluid retention. Then some people have an aura, which is the next stage. That can happen right around the time of the migraine, where you actually might have some visual loss, see some zigzag lines, even numbness or tingling, trouble speaking. And many times people might think they're having a stroke when that happens. The actual headache itself is the next stage, which can be pulsating, throbbing, usually one side, sometimes both. You can get nauseous and vomit, and also sometimes even feel dizzy, avoid bright lights or loud noises because that makes it worse. And then the last stage is the day or two after, where you can just feel exhausted and really worn out. There are a lot of triggers that we think about, definitely overexerting yourself, exercising too much, lack of sleep or change in your sleep pattern, change in how you're eating. So if you skip meals, stress, certain medications, hormone times of fluctuation, and even foods like aged cheese, red wine, or fermented foods. So lots of different triggers.
Aged cheese.
Aged cheese. A lot of the things that we love, even chocolate, unfortunately.
Yeah. So, you know, one question I think a lot of people have is, are there ways that you can prevent a migraine?
Yeah, there are. We think of a certain mnemonic, SEEDS. So the S stands for sleep, as I mentioned. You want to try to keep a good sleep hygiene pattern, regular sleep. The E is exercise, so 30 to 60 minutes of exercise most days of the week. E is eat, so try not to skip meals, because when your blood sugar drops, that can trigger it. Stay hydrated. The D is a diary. Keep a diary of your symptoms. And then the S is stress, so things like cognitive behavioral therapy and biofeedback can help.
So prevention's great, but some of us are just going to get them. So how do we suffer less?
Right, so there's certain medications. There are medications you can use to prevent, so things like antidepressants, anti-seizure meds, even blood pressure meds like beta blockers can be preventative. Then you have treatment meds, things like Excedrin or NSAIDs, Tylenol, and then the newer drugs like Nurtec or Ubrelvy. And then things you do when you actually get the headache, like I'll sometimes go into a dark room that is quiet, a cold compress on your head or neck, or warm compress, warm shower, and then drinking a little bit of caffeine can sometimes actually help.
I've seen those things online. Is it true you put your feet in water, like hot water?
I've never tried that, but maybe I should.
Can't hurt. At that point, I'm like, I'll take anything.
Exactly.
Ginger's at-home remedy.
I love that.
Don't listen to me. Don't listen to me. Listen to Narula.